So because our colleague Iztok Cukjati is not available, I will present his presentation. Just to open it. Yeah, so the presentation is about development of clinical interventions on an so-called academic research platform eHealth. eHealth is an old platform that was developed during a Slovenian research agency project a couple of years ago. It came from the same background or the same considerations that are presented on this slide. So the problem that we face in healthcare is that the increase in the societal economic burden for chronic diseases especially is huge. It's projected that, for example, for mental health related disorders, we will see an increase in 100% of costs, either direct or indirect, in the next 20 years. And we have so-called 5 big chronic disorders. There is a large group of brain disorders, which comprises around 15 to 20 disorders, psychiatric and neurological. We have cardiovascular, cancer, respiratory, and diabetes, and they take the major share of all the economic burden. People around the world, they think that we could create a better use of resources if we would implement the IT technologies in the long-term care of these chronic patients, but the implementation of these new IT technologies is quite slow. So, and another problem is that the available data is stored in local databases in hospitals or research institutions, and these databases are usually closed, so very hard to access from outside or hard to combine into larger databases. And they're also not properly structured, so there is an obstacle about how much time or how much resources we would need to try to harmonize them so they could be used together. Of course, there is also a very slow adoption rate of any kind of IT solutions into usual clinical practice. Or the healthcare workflow. So this is the background, and what the project, the eHealth platform project, tried to do years ago, a couple of years ago, during this Slovenian research funded time, it was they tried to come up with a holistic or a solution that would bring together all aspects of trying to take care of this type of chronic patient in an everyday clinical practice. So they started from a point where we have I think it's on. They started from a point when a patient visits a doctor and he performs a standard medical examination, and this medical examination can either be, the results can either be stored in a paper form or they can be digitalized. If they are digitalized, then we can bring in the IT solutions. So the medical personnel can then follow the patient via more or less simple parameters that are collected. And there is also another very important part of this process. Because of the lack of medical personnel or the increase in amount of administrative work and all other obstacles, clinicians don't have enough time to see patients regularly. So the idea is to try to replace this contact with an online contact, which doesn't need to be long, but it needs to be regular, because from experiences from abroad, what they saw is that people who are regularly in contact, even if this contact lasts for 5 minutes and they don't see a doctor but a care manager, they're more satisfied with their care than people who are included in a regular practice. So there was another important piece of the whole process is that the patient or caretaker should be supported by simple reminders or instructions on what to do regarding his disease. He interacts with the system by fulfilling tasks, taking measurements or filling out forms about his symptoms, and data is then sent to the central server, which can be located anywhere, but there is a very important requirement that this data should be stored in a national database in an interoperable format, so that all different, because our ecosystem of IT solutions in health care in Slovenia is quite diverse, and we need an interoperable system from which all of these different types of solutions can take data and use it. In the end, if everything works, the medical personnel is able to have a better control over the process and a better connection to the patient at home. This was the project, as I said, a couple of years ago. And now we are using the same platform because it's the groups that developed it at Faculty for Computer and Information Sciences are involved in the EMZ, Electronic and Medical Health Initiative. So we will try to adapt to what we saw as development in the last year, that it's not reasonable to try to come up with a better solution for everyday care of all patients, because larger commercial companies that are dealing with this on a regular daily basis with a lot of employees can do it much more properly and with a better user experience. So we decided to focus on trying to develop some kind of an academic or research platform that would be open to anybody who would want to use it for research purposes. But in the same time, whatever would be developed would be stored in repositories, in domains, so the data could be available for other people to use. So what we have is a common information platform which works for different domains of data, for different clinical disorders. It's based on the open air format, so all the data, the health data is modeled using a different type of software, especially the software for managing the processes in the health workflow. What they did in the previous project is that they actually tried to use it in 4 different clinical scenarios, and it was working. But what they saw was that the implementation or the adoption of the whole system was low, because, and one of the reasons was probably also not a good user experience. So, so here in this reinvention of the e-health platform inside the EMZ initiative, we'll try to improve it by putting more stress on the semantic interoperability by modeling the data. So we'll try to model as much data as possible for a clinical disorder that we'll work with. So far we have focused on two clinical pathways, as we call them, and one is for the control of atrial fibrillation. This is a cardiovascular disorder, a heart arrhythmia that can occur at different stages in people's lives, but we focused on post-heart surgery occurrence, which is quite often, as some sort of example of a clinical study. And we'll work on the Parkinson's disease, because we noticed that there is a lot of interest in Parkinson's disease from many groups involved in the EMZ initiative. What we'll try to do is to include in this e-health platform the advanced mobile peripheral sensors with wireless data transfer through technology which is already half or almost developed by other groups in the EMZ consortium. We'll try to also validate these peripheral sensors in controlled clinical studies, because we have this clinical knowledge. We'll try to further improve the semantic interoperability of data by really integrating all data with the basic clinical repository of patient data, which is now maintained at the National Institutes of Health. And we'll focus on trying to cooperate between academic research and commercial partners to develop this type of academic research software solutions or applications that could help other clinical groups that want to do research in this way. And we hope that at the end, when we get to the stage of fulfilling the clinical studies in these two scenarios, we'll be able to maybe update the existing clinical pathways for these two disorders, and also produce a prototype or instructions on how to do it for other disorders with other clinical groups. So focus is on the research part, not on the final user experience, but we are very open to work with all other partners, commercial or otherwise, that would like to work on this everyday clinical IT-supported healthcare. So yeah, this is what I wanted to say as an introduction for what you're doing, and thank you.
Thank you. As mentioned, we will be asking the first questions about integration. Thank you. Have you included any of